This is The Naked Patient, Beyond the Operating Room. Listen as Dr. Nicholas Howland talks with real patients about their real experiences with plastic surgery.
Hey, welcome to The Naked Patient. I'm Dr. Nicholas Howland. Today is a very special patient and guest of mine, Cori Moore. Cori has undergone several rounds of body contouring after weight loss. She had a very significant weight loss journey, and I'm going to let her kind of share that with you. Thanks for coming on, Cori.
Hi, podcast land. I mean, this is probably the podcast that if you can't handle, a lot of fucking swearing, then you probably want to shut it off right now. You're going to be clutching your pearls and shit and like, oh my God, this is not the episode for you. I'm just preempting it with that because I can't censor myself even if I tried.
I love that.
Yeah, like well.
How much weight did you lose?
150.
Total.
Well, yeah.
Okay.
Top weight was 350 and, swinging. There's like a 20-pound swing sometimes as you kind of stabilize. And then now that I've started plastic surgery, it's dropping even more.
When was your weight? When did your weight loss journey start? We'll go back to the beginning.
I don't know. It was probably like in my mid-20s where like I just had huge medical problems from being overweight. And so they were like, you have to do something about this.
What problems were you having?
Oh, like joint pain. I couldn't walk. My feet were screwed up. I mean, I just kept going to the doctor like, I can't move my joints. And she just finally was like, you have to do something about this. And so I just thought, I don't know what else I can do. Because up to that point, like I had lost like 70 pounds on my own. And it was just like, I had a lot of, like when I was young, I was really hard on my body. Like, I mean, you can go all the way back to when I was a kid, horrible, like have to be thin. I came up in the 70s and 80s where like thin was in. And like, if you were curvy, that was bad. Yeah. So I spent a lot of time just trying so hard to lose the weight. And like my doctor at the time was like, you've just abused your body to the point. I don't know.
A lot of us then were in patients or people were doing a lot of coke and heroin.
Well, I didn't know that then. Damn it, I missed my calling.
No, we screwed up a lot of people.
So it was a hard decision because I was sick as a child and I had a lot of surgeries. And so when I got to that point, it was kind of a situation where it was a necessary surgery, but voluntary. Okay. I got to choose whether or not to do it or not, but then you have medical people saying, no, this probably is what's best for you, but you have to like 100% commit because it's a lifestyle. Okay. There's no going back.
Oh, I've seen people reverse. My ex-wife's uncle is a bariatric surgeon, or I think he's since retired, but was very early on in bariatrics. He was like a pioneer of bariatrics. And he had a patient who had a gastric bypass and basically just ate her way out of it. Because you figure out very quickly what doesn't cause dumping syndrome.
And like at the time, I mean, I have family members that have had it. Mm-hmm. So I knew the complications that could come with it, and especially what can happen if you don't follow it religiously.
Sure.
And so I knew like it would be a huge change to my entire lifestyle. And it was a really hard decision. But at that point, I had my 3 kids. And it's such a dorky thing, but I went to a movie at Cloverfield, and it was like the monster movie, and they're all trying to run it. I'm all like, which kid could I even carry, and which kid do I have to watch get eaten? Because there's a part of that movie where like this guy's like turning into something. I'm all like, which kid do I like enough that I would try to save? And I know that sounds really fucked up, but I was like, oh my God, I got to lose weight because I got to figure out how to carry 3 kids.
I think the worst part is that it was Cloverfield.
Horrible movie. Shittiest movie.
No, honestly, there have been like some really weird Cloverfield adjacent movies since then that are actually, I think, phenomenal.
Oh, it was like the original. And I just thought, fuck, it was just something. And like, it was to the point with my feet, I had to sleep with my tennis shoes on to be able to get up in the middle of the night because my plantar fasciitis was so bad that when I would get up, it was too painful to even walk to the kids' rooms. Because my kids are only 4 years apart. I have 3 kids all within 4 years.
So before that, you said you lost 70 pounds diet and exercise.
I had infertility issues, and it was kind of something they're like, we don't recommend you have children until you do this if you're going to have fertility. And kind of that stuff. And so I did it, but then with the pregnancies, I mean, it just kind of.
So I guess what I want to get at is, was it straight to, I'm using surgery to lose weight?
No.
Or had you gone through it? Boy, I've done all the things I know how to do.
And I think that was what made like my PCP a great doctor, is because she knew that. She's like, I know you have done everything. And she's like, your metabolism is so screwed up.
Yeah.
And I'd gone to nutritionists, and, she had really worked with me, and she's kind of the first one. And I was really opposed to it. Just having seen what other family members have gone through, I was like, I don't think that's a good idea.
Well, and that's a point that I have made on this podcast before that I think is really crucial. I think a lot of people, so the whole podcast is taking away shame from plastic surgery, right? Mm-hmm. I think there's a significant amount of shame that people associate with bariatric surgery.
Oh, huge.
Society sees it as like this easy way out.
Oh, yeah. And I think even my own prejudice towards fat, I took it, well, no, you got to do it naturally. You got to do this. And I really had a hard time for a while and tried so hard. So when she started suggesting, I was pretty much like, I'm not doing that.
Yeah.
I do not want to do this. And then she just kind of worked it. And like I said, I just started feeling like, how can I be a good mom?
Yeah.
If I'm this big mom, like for many reasons. And I just was not happy. That's the bigger thing. Like I have a lot of big, beautiful friends, and they are active, and they are great people and women, and it doesn't bother them.
Yeah.
But for me, it was very emotional. I hated myself. I was like, this is not what I want to be and how I want the world to see me.
Yeah.
And so I just had to get over that hump of saying like, this is what is best. And then, I got introduced to RMAP. That's where I had mine. And they have an amazing program.
RMAP is Rocky Mountain Associate Physicians.
Yeah. And it was just, they have like a little like Saturday thing, and they kind of go over all the surgeries. And at the time, I only knew about gastric bypass. Mm-hmm. And so then they went over the 3 styles, and I knew about lap band and gastric sleeve. And I'm a simple patient. I love him. He was just like this big teddy bear kind of guy. And I was like, maybe I can do this. And I sat on it for a while, and it takes you a while to get insurance approved. Sorry. But it just kind of led to that. And I thought, I think this is the best option that's best for me. And it was a great program. What happened though is I had my surgery, and there were people in my group, they dropped their weight 6 months, 8 months, and they make you go to therapy. Like there's a 3-part therapy that you have to go to, because they want to make sure that like you can emotionally handle what's happening to you. But I was like a snell loser, like the turtles. Do they have a lot of little cute names?
What procedure did you go with?
I went with gastric sleeve.
The sleeve.
And I think I went with sleeve just because a lot of people in my family, were bleeders. There's problems there. Okay. And it really concerned me with them. With sleeve, they're literally just cutting your stomach is like a kidney looking, and they make it kind of into a tube.
Yep.
And instead of going with a gastric where they reroute your bowel, and a lot of your nutrients, obviously, here's a little health, comes through your bowel. And so I was like, I don't want you messing, because I'm young. I was young at the time. And I'm like, I don't want your absorbent dumping syndrome. We've already talked about that. The sleeve can be a milder option. And that's what he suggested for me. I'm like, okay, I'll go with that. Yeah. Just because of the Y incision and family members having issues with that.
Yeah.
And so but the group part was what kind of intrigued me, is that they were going to help us with that. But for me, it took me still 3 years to lose that.
Oh, wow.
Compared to and that was the hardest part.
So you're going to this group and everybody's just like, rah, rah, look at all this weight I've lost. And you're like, what the fuck?
Yeah. I literally, I'm all like, I'm losing a pound a week.
Yeah.
And they're all like, and I had a friend who had
which healthy as can be, by the way. A pound a week.
Yeah. Oh yeah. 1 to 2. And I was just like, and it's not that it disappointed me, but what was really interesting about it is like people in the group really kind of lost their shit. Like they would cry in these groups. Like one girl, I distinctly remember her so well. She lost it one night, and we're just like, holy, and she lost 300 pounds. Like
for the better? What do you mean by lost?
Well, just cry. They were just like, I wish I hadn't done this. Cause mentally what it does to you, being one way and then completely you just completely change. You transform in a matter of months, and you're not ready for that.
Yeah.
But like, what's interesting about it is just sitting there listening to these people all like, wow, like they were just like this one girl. I still remember she came in and she, you know, we all have terms for it or whatever, but you kind of look like a Shar-Pei. You know, you got a lot of loose skin, you know, and it's rolly. And she was younger and she was just bawling, saying, if I had known that this is how I was going to end up, I would have never done this. Yeah. Because she had tried, like, obviously plastic surgery is a big discussion that comes up in those groups because it is part of it. They do warn you that for all, you know, you're going to have it removed. It can cause rashes and there's a lot of things that happen with it. And
so for people listening, like this rapid weight loss after any bariatric procedure causes, you lose all this weight, but the skin often, most of the time, doesn't come with that weight loss. It doesn't shrink up. So when Cori says you look like a Shar-Pei, like you get big loose rolls of skin, especially if you lose a very significant amount of weight, and it can take a lot of plastic surgery to fix that.
Yeah, and so I think a lot of what I'm getting at is just sitting there listening to them, like they wanted it undone. Like they totally wanted. Like, and I mean, I felt really bad for her, and people just came in with a lot of like mental issues and just things that happen to you where you're just like, people treat you differently. You realize how vain of a society we live in. And I experienced that a little bit, but mine was so gradual that people kind of were like, yeah, you look good. Like there was not like my friend that I was going to talk about. She had her surgery about 6 months after me. And we worked together and love her to death. And then we went to different jobs. And I bumped into her and she came running up to me at Home Depot. And I was just like, who is this crazy bitch running at me? And I was like scared for a minute. And she had to get right up in my face and smile. And she has a little cute gap in between her teeth. I'm all like, holy shit. I didn't even recognize her. Because it was so dramatic.
Madonna? Sorry.
It was just so dramatic to me, like, holy crap. And that was not my experience with gastric. But it's funny that I went through that entire thing, went to all those classes and thought, these people are crazy. Like, holy shit, why are you guys not happy? But then the same thing happened to me when I went through plastic surgery. Is because it was dramatic enough for me that I'm like, I don't even recognize myself.
That's an interesting...
Yeah. So I went and that was 9 years. So it will be 9 years for my gastric, a couple weeks.
That gives me more insight into you a little bit. I like that. Yeah.
Because I would sit there and just think, and a lot of they're younger girls trying to do this or men. I mean, I remember the night, I won't say his name because we actually are still really good friends. He lost it because, and he was a little older than me, but he was like really struggling because he had always kind of been the big guy. And now he definitely was not. And like, attractive women were flirting with him or just paying attention to him. And he would say, I love my wife, but I don't know how to deal with women actually paying attention to me. Because and that was the night, like the, therapist, like, please realize that like, this is very private and you guys need to be respectful. Because we knew his wife, because you know what I mean? But he's like, I don't know how to deal with finally being attractive to the opposite sex. And so that's what I'm saying. We would just sit there. I just didn't have anything to give to the conversation. So I just spent like an entire year just listening to people talk about how body transformation changed their entire life. Yeah. And I just did not experience that.
Meanwhile, your life's just going on.
Yeah, I'm just
pound a week at a time.
Yeah. Running my ass off on that treadmill. Like Trang started bitching at the office. They're like, what, this shit didn't work, assholes? Like pissed. And like you sign claiming that like it doesn't work. Some people literally, and that you just don't. You lose slowly over time, like on a normal diet. But to have them cut out your stomach and not lose the weight in what you think you should lose it in.
Where in this process was, so I have a patient who worked at the time for RMAP, and she's coming on this podcast, so she'll let me share this. So her name is Maddie McKinnon, phenomenal person.
I know Maddie.
And she worked as a front desk or patient coordinator or something for RMAP. Was she on your journey with you? Had she already lost her weight?
Thing is what happens at RMAP, what they do is they like... you go to like the little seminar thing and then they only will take so many patients and you get in like it's like a queue, so to speak. Yeah. So the women or men that have surgery the same week you do, you see them at the hospital. So like, they're kind of like, so they kind of, it's really cool how they kind of orchestrate, like, this is what they've had. So as you go through group, these people are with you the entire journey. So she must have had it before. I don't remember being in the groups with her.
Okay.
She probably is on the Facebook group or.
Oh, I'm sure.
Yeah. But so the girls I'm talking about, they were in my group, the guy I'm talking about. So some of this, you go with them. So you go like, it's stage 1, and that's normally like the first 6 months. And that group can be a lot about, just the diet, how to live, like what some food makes people horribly sick, it won't make other people sick. So like, and then you go to group 2. It's kind of when you get to group 3 is where a lot of and people that stick with it, they don't force you and drag you into the room.
Yeah.
But if you start calling the office and saying, oh, hey, I'm having these problems, normally most of the time they're all like, are you going to group? Like, are you still like working on the program, or what are you doing?
How often does the group meet?
Once a week.
Oh, wow.
For a year. And they move you along so for me, they kind of just had to bump. I wasn't losing the weight fast. They're like, yeah, you just put her in stage. She's a turtle. She ain't losing it. But so it was interesting. I mean, I always like listening to other people's stories.
Yeah.
I mean, that's why, the podcast is a cool idea, because obviously I've told you and just said, like, if I would have had this when I was 20, somebody talking about a weight loss journey or whatever, it would have been amazing. Yeah. Like, kids today have so much shit that they get to like go listen to other people's stories that we didn't have. Like, you're just flying solo. You didn't know shit from Shinola.
Yeah, this is for everything. I mean, people come in for a simple breast augmentation. They're like, I've listened to 17 podcasts and I know exactly the type and the style and the gel and the profile. And they're like, holy shit.
I probably would have been far better off.
Let me just give you the scalpel, sir. I watched a YouTube video on it last night. You might as well freaking do it yourself.
So I just think like that experience of the gastric in general was just helpful to listen to, like, how much like transformation can really screw you up, good or bad. And definitely saw people, just really struggling with wanting it undone, things falling apart in their life, or becoming confident, or jealousy, or people. Yeah. And I just kind of hung out for a year with a group of people where I'm all like, well, I'm just, taking kids to school, and nobody damn near knows I've lost any weight because it was so gradual.
This is such a wild, like, comparison to plastic surgery, because I see the same process play out in plastic surgery patients, just completely unrelated to bariatric surgery and weight loss. Like, same emotions, same issues come up with friggin' breast augs, tummy tucks. Yeah. Like the same, like you can have, look, you know how many divorces happen after a woman has a mommy makeover? Which is really... It's shocking.
Well, but I'm telling you, like in gastric, it's the same thing. Yeah. Exact same thing happens to people, is because one, it's just traumatic. People don't know how to deal with it, or they change so dramatically. It just change in general. Yeah. Like when you start changing, and that's something like I've been going through thinking like, this has been roughly, I don't want to talk about my age, but we're talking a good 20 years of my life trying to fit into a mold of what I thought I should be. Yeah. And I finally got to a point where I'm like, I got to stop worrying about what people think of me or looking for approval outside myself. And so when I started like, not necessarily with gastric, because I really needed a lot of like, this is what you need to do, and this is what we're going to do. Sure. From everybody around me, that it was, and my mom's a nurse, and so she was very much involved in that process of helping me. But when I started plastic surgery, my mom was no longer with us. And so I had to go on the journey without her. Yeah. And I just kind of thought, I'm not going to ask anybody's opinion. I'm not even going to tell people. Because when I started having like knee and joint problems again. And this was like late 18. And I started going to a physical therapist and saying like, my knees hurt, I can't run on the treadmill. And I was just, I call it the bounce up. Like I'd try to do burpees and it's like half my body would go up and then the other half bounce that shit down. And it hurt all the time. I'm all like, so I thought I like had joint problems. Yeah. And so I was going to a physical therapist and he just said, he goes, it's the loose skin. Yeah. And I'm all like, oh no, I'm just a big framed person. And he's all like, no, you're not. and I'm somebody that argues with people. Like I have my...
What?
No. Peach. I'm just a little peach. I'm just a little extra.
Lovingly said from somebody who's argued with you about 20 frickin' times.
Well, we can totally get in. I totally want to talk about like even the journey of finding a plastic surgeon. That was fucking a trip.
We'll get there.
Oh yeah. So like being sick as a child, I just had like a lot of like, just didn't like medical people. So I'd argue with people. And so he was kind of the one, and I like when people push back and argue back with me, because I'm all like, come on, debate with me, motherfucker.
Yeah.
Come on, give it.
No, here's the point I want to make, though, based on something you said. You were growing and changing, and it can be shocking for a lot of people if they don't change with you. I had a friend of mine who would describe his process of change as climbing a ladder. And he's like, when I get to that next rung of the ladder, I have to, and this is really almost any change in your life. If you're going to level up in life, you have to oftentimes kill that person who's below that rung. And sometimes that includes cutting people out of your life. That always includes cutting out old habits, toxic traits, and sometimes toxic people. And it can, unless they're going to grow with you. And that can be really hard for relationships that have been there for a long time, or for behaviors and patterns that have been there for a long time.
Yeah, and what's funny that you talk about this is like, for my entire journey, I call it the born again fat person.
Okay.
Nobody fucking likes that person. Nobody likes the person that suddenly goes, I found the light, motherfuckers, and this is for everybody, and it's annoying as shit.
Yeah.
So when I started on my journey, I really tried not to be like, oh no, do your own thing. So I tried to almost kind of hide at times, like any happiness for myself, because I'm all like, I don't know how to even really, it was something I felt like I don't want to make anybody feel like they need to change with me. If that makes sense. I'm all like this
skinny person identifying as the still miserable fat person.
Yeah. Yes. Yeah.
It's a shitty way to say it.
Yeah. Well, or I didn't want, I don't know. Yeah. I just was like, I don't know how to like.
Were you scared of, not bragging about it, but were you scared of accepting that change? Like,
well, obviously I wanted it.
Or did you feel undeserving of that change?
Well, that's some of it, because, people are assholes. I mean, it's just a natural trait to like disregard someone's journey or the way somebody feels, or when people try to talk, oh, that's not really how that happened, or they'll say, you cheated, you went and, didn't do it the right way, and also if you have complications of any kind, they're all like, see, you did it. It's your fault. Yeah, fuck you. You're like, ha ha ha. There's a little bit of like digging almost with people where you're like, assholes.
Yeah.
Like, and so I just felt like I didn't want anybody else to feel like they needed to change around me.
Yeah.
But I also had a hard time celebrating any little mild. But I had, I was 350 pounds. I mean, it takes a lot. I mean, to be that big. I was not big as a child. I mean, I viewed myself as horribly big. Yeah. Like, and I always recently was thinking about with women in general, I call it the sorting. And all of us can really sit back and remember a time where you're in a group of women and the sorting happens.
Oh, for sure.
Where you start like comparing yourself. And I remember like being in kindergarten and it happening.
Yeah.
And so very little realizing like, I don't fit in. Something's wrong here. And I had my little bestie, Nicole, she was the person I was like, well, fuck you guys. Like, she never cared that we didn't fit in.
Yeah.
But for me, it was devastating. So I would do absolutely anything. It's a totally funny now, not funny at the time. Like, I was sick as a child. Like, I had every childhood illness a human can have. Mm-hmm. I had. And so, it's, oh my God, I can't believe I'm going to tell you guys this. Fuck. God damn it.
Love it. Bring it out.
Oh.
It's therapy. I'm telling you, this podcast is therapy for both me and the patient. Like the people, or not just patients, the people I bring on. It's
so like I was very around. I didn't talk until I was 5 years old because I had horrible ear, nose, and throat problems, and so I was very ill. So I was really hard to potty train. So when I finally got to go to kindergarten, I was like in resource. I had all of that going on. And I remember all the little girls standing around and they all were pulling up their skirts to see like what kind of panties everybody had on.
Okay.
Well, I was still wearing training pants. I was 5 years old.
Yeah.
Oh, and that, there's always that one bitch in the group.
Oh, God.
Oh, and I remember, and it was me and Nicole, and they all had Barbie.
Yeah.
And they all had all the cute panties, and I just didn't even realize that this was going to be a bad thing. And I'm like, oh, I want to be blonde.
Check
Pulled
out
it
my
up.
training pants, guys.
Oh, that little bitch. She's all like, you're a baby.
Yep.
You're a baby.
Yep.
And I was just like, no, I'm a big girl. And she's like, no, you're not.
Yeah.
And they wouldn't play with me. And I still remember that, being so isolated and feeling like I'm a dum-dum that has to go down to resource. I can't read. I can't talk. And like when you have a lot of ear problems as a child, it's kind of like you hear like the Charlie Brown. Wah, 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 wah. Like that's what it sounds like to you. And you're trying to like understand. So the weird thing is you really pick up on like nonverbal cues. Mm-hmm. And I remember as a child realizing and reading people early, like what was really going on, because I couldn't really comprehend sometimes, like, because I couldn't hear them.
Yeah.
So then that, like, this is the funny part, is so these two things recently, my mom journaled a lot, and I have some of my own medical records and stuff that I've got to go through. And so I've kind of got her recollection, and it's kind of helped me tie it all back to what I remember happening. And versus her, my mom was a surgical nurse, and like that was her calling in life. And so when I was little, like all my surgeries were done at LDS Hospital, and I was just like, mom was always there.
Yeah.
But when I turned 5, they really, at the point, and this is back in the late 70s, early 80s, so medicine has come a long way.
Yeah. I was born at LDS in the early 80s.
So was I. Good hospital. But they finally said, we have to take out her tonsils, adenoids. But by that point, I had like tubes in my ears like 7 times. They kept trying to do it over and over again. It was just really bad. Anyway, so obviously we have the panty issue where I felt like, oh, I don't have the big girl panties. And then my mom, we went to Kmart, and I was like, Mom, I really want these Rainbow Bright, and trying to tell her I have to have these Rainbow Bright panties.
I had the same conversation with my mom.
Really? Were yours Rainbow Bright? Let's talk about your Rainbow Bright panties, buddy.
Continue.
Anyway, so, and bribery is always, and so she's like, well, you have to go have surgery. And I remember having the surgeries up to that point, but she was always there. Like, she carried, like, and to me, like, nurses were mommies because they were all my mom's friends.
Yeah.
So I don't really remember ever being afraid. But then we had to have it done at primaries. And my grandmother, like, real quick, like, I have, like, a nephew. Not my nephew, but my grandmother's nephew back in the 30s. They tried to do a tonsillectomy and he died. And so it was a huge traumatic event for my family. But my mom's all like, we have to do this for her. And my grandma's like, no, we can't do this. And so my mom was already kind of nervous. And it's still talked about. Like, if we go to Memorial Weekend and they're decorating the graves, we all have to stand around and talk about, him because it was so traumatic for them.
Yeah.
Anyway, so my mom was all nervous, but she's like, I'll give you these. And we're going to go, do this thing called surgery. I'm like, yeah, whatever. Give me the fucking panties. Like, that's all I gave a shit about. Like, bribe me all you want, ma'am. Don't care.
Meanwhile, you realize you're telling me where all of your insecurities
this is coming out.
Professionals came from.
Yeah, this is what I'm telling you. You said, I want vulnerability. Okay, I'm going to tell him the fucking panty story. Then he's being like, shit, this girl's fucked up. No. This explains an entire year in one story. So we went up. It was primaries, the old primaries in the avenues.
Yeah.
But I
remember the haunted one.
Oh yeah.
Yeah.
Mm-hmm. Creepy as fuck.
We used to try to break into that as teenagers.
Yeah, but after they moved primaries.
Yes, yeah.
But this is when it was still operational. The ghosts were not there yet.
Sure.
Well, probably fucking were, but whatever.
Before all the kids died and became ghosts.
Oh God, it was creepy. Anyway, so I remember like they all wore white back then. Even the doctors, everybody wore white. They wore, and so I assumed everybody was nurses. And so obviously, I got my Rainbow Bright panties and I'm all good to go. And I remember my mom like it seemed like she was arguing with this guy. And now in retrospect, I'm like, holy shit, that was the doctor. But it was like, she didn't work at primaries.
Yeah.
She worked at LDS Hospital. So they were not like, no, you can't come in to the OR. Like, you're not allowed in here. And I just remember being like, like, I didn't give a shit.
Yeah.
And so she's like, come on. And I remember like, now, and this is not the cool primaries, anybody that's taking their kids up to primaries where these kids get to ride wagons and they drug the shit out of them before you take them in. Like, no, that shit was going on.
Nuh-uh.
No, it was like the philosophy of, they're not going to remember anyway what the fuck we do to them.
Yeah, it was like cages.
We're getting to the cage story. This is going to make you laugh your ass off because anybody that's out at Canyon Crest that have woken me up off of hasn't changed. I'm crazy as shit off that shit. Anyway, so my mom, we come around the corner and there was like a fucking lady there that was like a mountain waiting for us. And I could tell my mom did not like her.
Yeah.
And having read some of the stuff, I realized like they knew each other and she didn't like her.
Got it.
And she had to turn over, her baby girl to somebody that she had no respect for. And so they kind of like, I just was like, dude, I didn't care. I just thought she was going to come with me. And I remember the lady grabbed my forearm and started like pulling me through the doors. Uh-huh. And my mom's like, please be a good girl. Because I was I was an unruly child, bit kids, like I was wild as shit. And I remember going like, where are you going? And she had to drag me into the OR. And I remember like the metal on the lower half and this distorted image of it and just scared shitless. Yeah. And so she drugged me back there and I remember, be good, please be good for them. And I was just like, fuck you, take your rainbow bright panties and shove them, like get me the hell out of here. Yeah. So she and I just remember that nurse taking me back there and that like seeing that OR for the first time, I just remember standing there thinking, what the fuck is this hellhole? And there was like the bottles, and then back then there was gas. They'd put gas on you to kind of relax you before they took you out. And it was like banana and grape and cherry. But she was just a horrible person. And I remember thinking, oh no, I'm going to pee my pants. I'm going to pee my pants. So not only like public humiliation already going on in my little brain, but I'm all like, and I'm going to get in trouble. Because back then, like, don't judge my parents, but they spanked you. You did something wrong. You got spanked, smacked around a little bit. No one gave a shit. That was where, now we realize, like, corporal punishment for a child that's struggling, probably not the best idea.
Somebody's going to go back and cancel your parents.
Yeah, basically. Anyway, so, like, obviously, peed my pants. And that nurse came over to me, and she stripped me down right there in the middle of that. And I remember thinking, oh, my God, what is going to happen in here? Yeah. She took my rainbow bright panties, and I distinctly remember watching her throw them away.
The new ones.
Yeah, the ones that I wanted to fit in. Oh, wherever you are, ma'am.
Oh, man.
And I just remember, and there was another nurse, and you could just tell, and I think that's the early memory of, like, good medical people and bad medical people. People, you know what I mean? And I remember, because my surgery journey or being sick as a child, I was not really till I was like 10 years old.
Yeah, suddenly distrust was born.
Oh, yes, of all you bastards. Yeah. That's why I got to tell a story, so I'll explain to your poor staff. They're like, that's why, like, this year has been a hell of a ride with Cori. But recently I just thought, I'm like, what the hell was the entire, especially because my mom was not, she's been gone 4 years now. And so just realizing I had to do this without her. Yeah. When she'd always been there for all of it. Like my cat, like surgery, sickness. We had a troublesome relationship, but in regards of her as a nurse, she was fucking amazing. Like that was her calling. Yeah. Like I remember like, we were predominantly of this culture here. So, and like the bishop being like, well, we need you to take a calling. She goes, my calling is nursing. Like, go fuck yourself. I don't need to be the librarian. Like, so, and it was just something where I was like, wow, like this is her thing. And she was amazing at it. So I never had to worry about being taken care of because I was like, oh, she's going to take care of me. She's going to fuck up everybody for me. I don't got to do shit.
Oh yeah. There are a lot of nurses I know that's
their life.
That absolutely. And they really have that calling of like healer and nurse.
Mm-hmm. And no, it's like in their blood.
Absolutely.
Like they do it for free.
Oh, 1,000%.
Yeah. Like which is sad because they need to be paid more.
Oh God, yes.
Pay them more. Raises are coming, ladies.
Dakota, cut that part out.
Anyway, so like I just remember that, and I remember like the sorting that was happening, like realizing I don't fit in over here. Yeah. And just being sick all the time sucked. Yeah. It all like even now, like I have no idea why people enjoy being sick. Like I've met people where they're like, I'm like, what the fuck? Why would you want to be sick?
Did it get better after that surgery?
No, like it was. I did start talking finally, but from like kindergarten until almost 6th grade, it took me that long to get caught up, which did not help the public bullying and like I remember this one kid and these kids like this is small lake city, right? Yeah. So like we all knew each other. We're just 3 pligs apart, all of us. Yeah. And so I just had to go to school with them all the time. But I just remember that being the beginning of like knowing that I didn't fit in, and constantly trying to figure out, how do I make friends? How do I be accepted? Instead of just being me. Like I said, like Nicole, like prime example, she didn't give a shit. We played just fine, me and her, because she was not LDS. So she was on the outs just for that alone, growing up in the 80s here. Like she was screwed. And so we just played together because, you know, for whatever reason, like women were just that way. Sometimes there was just this one girl, and she just constantly pushed me out of the inner, which was fine because then me and Nicole just became the bestest little friends.
Yeah.
Anyway, so like what happened, I'm getting to a point here. I swear to God.
I'm loving it. I'm just letting you go.
You're going to be so regretful that you put this mic in front of.
Nonsense.
So then obviously the gastric, and so illness just got better. But I just remember early on, like just being very worried all the time about fitting in. How do I measure up? Where do I sort? And obviously once you get into like junior high and stuff, realizing even worse. Because at the time, like there was no Ashley Graham, Kim Kardashian for my ass. Like you had to be skinny. And if you were curvy at all, you were fat.
Yeah.
That's how it was for us. Like there was no ideal of like body, like kids, like really grateful that my daughter's being raised in an environment where it's a lot more acceptable. There's still some screwed up shit that goes on. I'm not saying like it's a beautiful, but body, like the thought of body image and stuff is a little bit more accepted. You can be thin and athletic, and you can be curvy too.
Yeah, we're a little more communicative about it, which I think is good.
Yes.
Kids are still
fucking mean.
Yeah.
It's never going to change. They're a little bit more stealth.
I mean, where's kids too? You know, I mean, kids are products of their environment. And I mean, a lot of that shit is stuff they're learning from their parents.
Yeah, like if you were a shitty individual in the 80s and 90s, I will bet high dollar amount that your kid's probably a shithead too.
Yeah.
Because you're just going to teach them it, because that's how you think life works.
Yeah. Or hopefully you broke the mold. Like,
well, yeah.
And broke out of that, which I think is one of the good things about living in today and living in that kind of this super high tech, high information era is I think a lot more people are breaking that mold. It's more acceptable to talk about trauma. It's more acceptable to talk about depression and about problems. And that's the good side of all of this, right? Is we've become more comfortable with being vulnerable and being authentic because we've realized that actually is a good thing and it makes us happy. Whereas, I mean, it was such a, we went through this time in humanity where if you were vulnerable or authentic, you were less than somehow. Yeah.
Oh, and like all of us went through this. Like there's not a human being, like if they're wanting to open up, and everybody has the story. Everybody has the panty story. They have that horrible moment where they knew they didn't fit in. And the sad thing for us is there was no internet. Mm-hmm. So if you were on the outs or you did not fit into the circle, and like plenty of friends, like, and we were just the loser club. Like there was just a group of us where we're like, for whatever reason, we just could not fit the mold of the popular kids.
Sure. You want to hear the sad part? For me, as you tell that story, I have a similar story, but I was the dick.
See, and what's interesting, so this is going to be a good conversation for us, is because I think most people, you either remember being the dick or the bitch, and you grew up and you either experienced the flip side and realized how horrible it was and you changed, like maturity or whatever, or sadly, you still haven't changed. Like you're just still the same asshole.
For sure. I mean, don't get me wrong. Like I had things that people found something to tease you for, right?
Oh yeah, we were all horrible.
Yeah, I had things that people teased me for that were traumatic for me.
Yeah.
But as you told that story, I'm just like, God, I just had this sadness for being that asshole. I remember it was my cousin. I had a cousin who, late bloomer in potty training. Dude was like 9-10 years old and had to wear alarm panties.
I knew it. You were a freaking dick.
Yeah. And his alarm went off in the middle of the night, and we teased him. And
oh yeah, it's horrible.
Like, what a shitty thing to do.
Right, and like it was funny, like to them. Like that's what's really sad about it is like, talk to family members and stuff. I don't like teasing for a reason.
Yeah.
Because when you're teasing somebody, there's some truth to what you're making fun of them. You can't tease somebody about something that's not true.
Yeah.
So if you're poking at somebody, and within the families, sometimes people are like, "Oh, I'm just teasing." You're being fucking rude. You're taking a piece of something about them and poking at them. Yeah. And some people are like, "Oh, you're right. I'm clumsy."
Yeah.
Or whatever. But some people, they do it in a way where you're like, "You're being a dick."
Yeah. I had an experience with some friends of mine we were in Scotland. It was a group of high school friends, and we, for a long time, there's like 8 or 9 of us, we've always kind of gone on a trip every other year. And which has been really cool. I mean, we're 20 years out of high school and we still see each other regularly, and we're great friends. And we went on this trip, and my buddy Jimmy, who actually owns the studio, Jimmy Rex, he plans these amazing Mr. Jimmy Rex. He plans all these amazing trips. And he had planned this one, and we're like,
"How do I get invited, Jimmy?"
You got to come back to high school with us. Go to Murray.
Murray sucked.
Oh, come on.
Oof.
We'll get there.
Oh, Murray.
We'll get there. So we are.
West Side.
We are on this trip. Let me tell my story, Cori.
Oh, no.
We're on this incredible trip, seeing incredible things, and we're 5 days in, and we're just being dick high school kids to each other. Like,
this is recently, or
this was probably 3-4 years ago.
Oh, okay.
This was a turning point in
your dickheadness?
All of our. Well, not that. I'm still that. Like the relationship that we have with each other. This group of core high school friends that I have, and the whole trip we were just like doing what we would do in high school. We're just like teasing, not in a loving way, but just to freaking tease and poke the bear and see who could
lose their shit.
It was that sorting stuff that you talked about, right? Like who could make fun of who the most. And we just kept on ragging on people over and over and over. And it got to a point where we were trying to get to this hike that Jimmy really wanted to do as part of the itinerary. And he has planned this whole thing. And we're getting lost, and we're getting turned around. We're having to flip around, and everybody is just giving Jimmy crap for it, like making fun of him that we're lost and trying to get to this hike. And finally, he just like snaps and loses. It's like, you know what?
Fuck you guys.
Yeah. Oh yeah. He's like, I'm sick and tired of us just like being shitty to each other. F you guys, and got out of the car and took off up this mountain.
Good for you, Jimmy. Fuck him.
So we followed him up that mountain, and after getting him to calm down, we went back to our Airbnb that we were staying at that night, and he said, "We're not doing this anymore." And he forced us into this kitchen, and this is one of my favorite moments in life. The 9 of us sit in this kitchen in friggin' Isle of Skye, Scotland, one of the most beautiful places in the world. And he said, "We are not leaving this kitchen until every single person in this kitchen goes around the room and tells every other person something that they love about them."
Wow.
And then tells them that they love them. And there was not a dry eye in that kitchen. We went from, hey, we're just teasing to be dicks to, no, dude, I really love you, and here's why.
Right.
And immediately the relationship with all of us changed overnight.
I'm getting goosebumps because it's amazing, like when you can do that.
Yeah. Well, and the great part is you can still joke with your buddies, right? You can, but it's only done in a loving way. It's never done in a way to make them look bad,
or feel lesser
than, or put them down in front of somebody.
Right. And I think a lot of us fall on that, right? Like, it's teasing. I'm just teasing you. And like, obviously my husband is and we had it out early where I'm all like, I don't like it. Because I have a really hard time knowing when you're teasing me or when you're making fun of me, because I spent a pretty big part of my life being made fun of.
Sure.
So I can't figure it out. And so sometimes like somebody's maybe so you have to be really close to me. And I have probably maybe 4 people in my life that I will tolerate it. But I know like we're ride or die. If I called them and said, get a tarp, we got to bury a body, they're coming. So they can say whatever the fuck they want to me because we're all going to be cellmates. But most people, I'm very reserved because I'm all like, what's your real intentions? Because you find, you know, people are very good at being conniving.
Yeah.
And taking information about you or finding something out about you and just being able to just fuck with you. And it's like something that I always think, why do people enjoy doing that? What do you get out of that? And so just growing up that, like, God, we're getting all into stuff. I'm losing my thought. So I just don't trust people. So it's very hard. And obviously, like I was saying, then you add in illness or sickness or anything for me. Yeah. Then like that OCD controlling, I must control this environment so I can control what's going on. Yeah. Because I'm petrified of what could happen to me. And so going into gastric surgery was a pretty smooth situation. And the one thing that I will say about my own journey, because you asked like the weight loss journey, what was really great about mine when you talk about people that their gastric doesn't turn out as well or as they go on in the years, those first years were really good for me because I learned what maintenance was. I learned to be patient in a way that I had never been in my life. Yeah. In regards to my physical appearance. Because when I started, I really made that commitment of saying, I want this to be healthy. Yeah. And if healthy for my frame is 300 pounds, I guess that's what it is. If I'm exercising, eating right, and I'm doing what I'm supposed to be doing, and I'm still this physique, I need to learn to love that physique.
Yeah, and that's a hard thing for a lot of people to realize, right? It's always, every time I get so annoyed when I hear, because it's always the same person who says this. It's always like ripped out gym guy who's never seen an extra pound in his life. It's like, if you just eat like a carnivore diet and go to the gym some more, you'd be fine. And
I love those people.
Right? Like,
those would be born again gym people where you're like, shut the fuck up.
Some of the most healthy people, I've said this on this podcast before, some of the most healthy people I know, at least in terms, and hardworking people, they're 300 pounds.
Yeah, no.
Now, that's not to say that like 300 pounds is healthy for you. No, that's bad for you. But those are people who I know are eating all the calories right. They're eating their macros the way they should. They're going to the gym every single day. And they are diligent as fuck. And they cannot lose that weight because they've got other stuff going on. Their metabolism's screwed up. Their thyroid's screwed up. They've got cortisol issues through the roof. And they can't do anything about it. And by and large, that's a lot of the people that are having bariatric surgery.
Yes,
absolutely. And so when I get people that suggest that bariatric surgery is like cheating or an easy way out, we're going to have some words.
Well, I find it to be ignorance.
It's just ignorance. They don't get it.
Or they don't know how to ask the right questions. Like to me, they're not able in their own ignorance, like talking about ignorance in general. I think people, when they don't understand something, they just don't know how to ask the why. Yeah. And since I obviously really love to understand things, maybe a little bit too much, I probably download way too much information sometimes, and it's too much, and I don't know how to. I just think, I'm like, why don't you ask why? Like, if you want to know something about somebody, ask. Yeah. Inquire. You might learn something about yourself. You might learn something about them. It brings that closer. Like you're talking about when you guys all finally decided to not be dicks and talk to each other, there's that tighter bond. Yeah. You bond together where you're like, you see the reflection of yourself in another human.
Say that again.
When you look at somebody else, you see the reflection of another human. Yep. You see yourself. Yeah. Right? So when you look at somebody, and if you don't seek that out, you're kind of like a narcissist. Like if you can't look at somebody and be like, I see you for who you truly are, and you're beautiful in and of yourself, it makes you realize your own beauty if you can do that. Yeah.
Most of our actions and reactions, we're just mirrors, right?
Oh, yeah. Mm-hmm.
And it's the awareness of that mirror that allows us to change.
Well, self-awareness, damn sure.
Yeah, like if I'm being a dick to somebody and I realize, that has nothing to do with that person. Almost never has anything to, like any negative emotion that I have, almost never ever has anything to do with that other person. Even if I'm like completely convinced this person is doing this to me, if I take a minute and say, hold on, like what's going on? Almost always I can find out, oh, this is me. This is on me. Mm-hmm. And I take the victimhood out of it.
Well, I think, yeah.
And
that sucks though. That's we're talking about change or really being able to change is having to look at yourself in a light very unflattering.
Oh yeah.
Like you have to step back and be like, what is my piece to this puzzle? Mm-hmm. This is all fucked up and it's a big old mess, but what did I do to contribute?
Yeah.
Because you can't change that other person because they might not see. No. But you can say, these are my puzzle pieces and this is what I did and this is theirs and this is what it is. And you slide it off the table and you move on.
Yeah.
And that's been probably the hardest part of my journey just in general of my life is realizing that sometimes I just don't get to like right fight. You know what I'm saying? Like you don't get to try to convince another person.
No.
And that's hard for me because I'm all like, oh no, I'm going to help you understand my dickheadness and yours so we can be better friends or better family or whatever. And I've had to say, like I just get to take my own and move on.
Yeah. Sometimes they're just not gonna.
No. Which is hard.
Thank you for coming on so far. Like this is awesome conversation so far. I think we're actually gonna make this like a 2-part episode, maybe 3 parts. I don't know. I mean,
I have a lot of shit to say.
I know you've got a great story to tell.
See, what's so funny? I don't think it is. Like, but whatever.
I think it's phenomenal.
Oh,
and
well.
It's therapeutic for me. I do this for selfish reasons. I believe it's therapeutic for the people who come on here. I keep saying patients that come on here, but a lot of them are patients.
Well.
Tell me, before we end this episode, I want to get at least up to the point of you meeting me and deciding on, okay, this is my guy for plastic surgery.
So like in 19, like I was saying, I had gone to a physical therapist and I'm like, well, no, I'm a big frame. And like, I love medical people that kick me. Like I just do. Like when they're all like, you gonna tell me my fucking business, bitch? I love it. Cause then it like makes me like stop and be like, ooh, they actually know their shit because they're willing to fight for their ideals.
Yeah.
So he's all like, no, you have a very small frame. And like my whole life, I have thought I was a very big person. Like I just have. And he's just like, you don't. And I'm like, no, I have a big bone structure. And he's like, no, you don't. I'm like, no, yeah, I do. And he's just like, you telling me I work with people all goddamn day. He goes, I don't come to your job and tell you how to run spreadsheets. Don't fucking tell me body types. And I'm all like, oh, sorry.
You don't remember what I told you our first time we met?
Well, I remember.
I will tell you what I know I told you because, first of all, this is this came from one of my mentors, John Bauer, who is somebody who I try to base. He's a plastic surgeon. He's now in Alabama, I believe, but he trained me in Texas, and his bedside manner is phenomenal. Like if anybody's bedside manner that I can emulate, it's his. He is a phenomenal person at kind of communicating with people and making them feel comfortable. And I saw him all the time just get right down with patients. And he doesn't tell us to everybody, but he tells us to the ones that it's true of. And this is with weight loss patients. And he'll grab, or tummy tucks or anything like that, where we're doing skin removal. And he'll say, sweetie, there's a skinny girl under there.
Well, and that's so and like
by
wild.
Golly, we're gonna find her.
Well, because you don't see it that way.
It's true.
You just don't fucking see it.
No, you don't. But
especially if you see yourself as a plus size person.
Sure. But the physical therapist sees it. I see it as the plastic surgeon who's going to cut it off.
You mean Buffalo Bill? We'll get into that, folks. How he got named Buffalo Bill. It's funny as fuck.
Continue. But he was right. You are not a big framed person.
But like for like just, podcast land, I view myself that way. I respect people's perspective.
Of course.
But my perspective of me was like this big fat girl.
Yeah.
Like not just fat, but large boned.
Yeah.
Which is hilarious, but whatever.
It's a flawed perspective. But
yeah, that's fine.
Carry on. You're wrong, but continue.
Fuck you. So what happened is, so he was trying, and I went again to my doctor, and I said, is there any way that this skin, is he right? Like almost getting a second opinion from the physical therapist, going back. And this is the shit I do. Like I will go around and around and around until I'm absolutely positive that the analytical data I have is true.
Yeah.
To the point that people get almost fucking pissed off at me. They're like, shut the fuck up, please. I've already told you 9 motherfucking times. Don't fucking call again. Like I have very patient, loving people in my life, and you guys know who you are. And when I call and you're like, didn't we just fucking Groundhog Day, Cori? Jesus Christ. I told you. And I'm like, just tell me again.
Didn't I tell you this was the surgery you needed?
Oh, I'm so roasting your ass about meeting you for the first time.
No, let's hear it. That's what
no, so like what happens, I thought, and she warned me though, your BMI might come into play. Like there are plastic surgeons that will not operate on you because they will see you as high risk. And so, and I just remember thinking like just that rejection factor, like I am not going to be able to take it.
Yeah.
If I go into these offices and be told, you're still not good enough.
For sure. Oh,
you're still not good enough.
And what I will say is too, there are a lot of plastic surgeons who have that BMI cutoff where they won't operate on you if your BMI is over 30. And that's it's not necessarily them being jerks or rejecting you. Like there's real data that says that your complication risk after surgery, your risk of wound dehiscence, of other problems is much higher.
Oh yeah.
And it's either they don't want to deal with those problems or they don't know how to handle those complications. For me, this is kind of part of what led me to do a lot of body contouring in my practice is I trained in Houston. And my mentor was like one of the top 3 body contouring
600-pound life.
Yeah. She was it. And I mean, she wrote the book on body contouring, literally. And I know because I wrote some of the chapters for her. And
little arrogant, folks. It comes in.
He is a little bit arrogant.
But it's helpful.
But
you want sprinkles of that in a human being.
A little bit. But
just a little.
This is Dr. Linda Phillips, and that was what she did, was body contouring after weight loss. And in Houston, this is not Utah body contouring after weight loss. These are people who've lost 300 pounds and still weigh 300 pounds.
Yeah.
So when somebody comes, I don't have a BMI cutoff.
Nope.
Because I know how to handle those complications. But I will tell my patients, hey, you are at higher risk, and that's okay. Here's what that risk is. Here's what we're going to do to manage and mitigate that risk. And I'm going to get you through it. Anyway, continue. Sorry. I had to toot my own horn there for just a second.
And now let the roasting begin.
Bring it on.
Anyway, so
I build myself up before I let you break me down.
I'll build you back up, bitch. Don't worry. So I just thought, and I think at that moment in my life, so like my mother had passed away, a lot of shit was going on in my life, and I just thought, I'm going to go on this venture alone. I'm not going to tell anybody that I'm looking for a plastic surgeon, because I had a deep fear that they were going to tell me no. And I just thought, I won't be able to handle it. And if I have told people that I'm doing this, then it's like that public thing of them getting to go, oh, she didn't lose enough. She's still not good enough. And it was bad enough that I was going to feel that myself. But so I didn't tell anybody, including my spouse. I'm all like, I'm just going to start fucking booking these appointments. Yeah. So this was early 19. And so the first 2 dudes that I went to, and they were dudes, fuckers, they did not disappoint on what is everything wrong with fucking plastic surgery.
Sure.
I walked in, their fucking offices were the Stepford wives. You totally knew what their flavor was because all the women were exactly the same, like creepy shit. And I'm all like, yep, this isn't gonna fucking work out for me. And both of them just kind of, it was like, you know, I'm not necessarily somebody that likes to be nude. And having to strip down and let somebody flop all your fat and bounce and be like, like hitting, like it was so horrible. Like grabbing the fat chunks on your body, like gotta cut this off, and it was horrible.
Yeah, it's a terrible. I mean,
it was horrible. Yeah. And like what I remember distinctly about them is they didn't even really ask things about me. It was like, what am I, a cattle asshole? Like at least ask my name. I mean, I know I wrote it down, but so those 2 were horrible. And and their pricing, it was just shit show. It was just a shit show. I'm like, fuck you assholes. So then I went to the third guy. Yes, it was a dude.
We're not going to say any names on this podcast.
No, I know, but I'm just saying, like, and I remember, like I said, my primary care physician saying, get lots of consults.
Yeah.
For sure, make sure that you, even if you like the first person, go to 2 or 3 more. So the third guy I went to, this is before I knew what board certified plastic surgeons were.
Okay.
So the third guy I went to, he was on my insurance panel.
Yeah.
And so I thought, well, I'll go to him. And so he literally like looked at me, opened the robe and was like, no. And I was like, fuck.
Just said no.
And I kind of got a little like it upset me that he was just, and he's all like, you need to sit, I need to explain something. He goes, I'm a general surgeon. Uh-huh. And I'm all like, what is, like, and I'm all like, you're not a doctor? Like, I didn't even fucking know what that meant. I'm like, what are you, a fucking freak? Like, why am I here? Yeah. And he's all like, he goes, I do like panectomies where they just literally cut off the skin. There's no like shaping at all.
Yeah.
Like, and he was like, I do lifts, but I do it like insurance where you have to take so much. He goes, I'm not somebody that you want to come to. That if you want contouring, he goes, you are going to need a body contouring specialist. I didn't even know what that was. I'm all like, what the? And then he's the one, really great dude. He's just like, you need to go find a board certified plastic surgeon. And I'm all like, I don't understand the difference.
Yeah.
And so he, like, great doctor in regards of him explaining, like, you're going about this wrong.
Good for him.
Yeah, like, cool dude. Good guy. If you're on PHP, just look up surgeon. If you need gallbladder removed, I'm sure he's awesome. So he went over that with me, and I went home, and at that point I was pretty like dejected. And this is like the end of 19, so we're heading into like the shit show of 2020. Yeah. And so I started booking a couple other appointments, but then like 2020 happened and stuff. And so I just thought maybe not. But I follow a couple girls similar large weight loss, and they had all gone to Mexico. So I started entertaining the idea, but I just like, how does a mom of 3 go take fucking 6 weeks and hang out in Mexico? Like, I quit my job, that didn't pan out. But so then Dr. 5 and 6, that I went 1, 2, 3, 4, 5, 6 doctors, I just kind of kept hopping around. One did a virtual. Let me tell you, people, like trying to do a virtual consultation, nude.
Oh, it's miserable.
Yeah,
when we went through the virtual consultation phase, I was like, just send me pictures. Just send me pictures and we'll talk about it.
That was creepy. I'm like, how the hell do I even know where this feed is going? But whatever, I guess.
It was a weird time.
Okay. So the other two were similar, but like I was saying, I follow some people online, and I reached out to one girl that I've become close with. And I said, how did you choose your surgeon? Because she did go to somebody here. He's in Virginia. And I said, how did you choose him? Mm-hmm. And I go, and she's had multiple surgeries with him. And I don't understand how this works. And she said, you have to like him. Yeah. And I'm all like, I don't like anybody. Fuck, I'm screwed. I don't like anybody. And she's like, and I'm like, why? And she goes, because it's going to be really traumatic. You've got to like the person. And she goes, and you have to like The Office. Yeah. And I was like, fuck.
It's your family for a little bit.
Fuck was all I could think. So I went to the last guy. I won't get into it, but he's Mr. Hollywood. And he was a dick. His work is beautiful, and I won't say his name because he's very popular. But him, like, I could just tell him, like, I'm not going to fucking get along with you. I know that I will not like you. Yeah. Even though, like, like I said, he deserves the credit, but I'm all like, I don't know how your patients like you because you're a dick.
Okay.
But what's funny about it is I was going to book with him because I'm all like, this is like probably the guy. Ironically, when I made the appointment, somebody had mentioned your name, and I thought your name was Howland, like the country. So I Googled the fuck out of some doctor named Howland and Draper. There is no such individual, people. Learn to fucking spell. And I spent quite a bit of light. And then somebody posted your name in the
that's the domain name I should invest in.
It was bad. Okay. Like, because I'd heard your name mentioned. So when I finally figured out your name, I looked it up, but you were too young. And I know that's horrible, but I'm all like, oh, he's younger than me. He can't possibly. So I called the office and made an appointment. And then I was thinking about going with the other guy. So your office called because I was on like the wait list. Okay. Because you had a long fucking wait. And I'm like, oh, fuck.
Yeah, I'm popular too.
Fuck, here we go. But I was already so pissed off. Like when I showed up at your office, I'm all like, I'm probably just going to roast this motherfucker because of all the other motherfuckers. I was just pissed.
I'm so glad this was me.
Oh, it gets good. So I show up, they call and said, do you want to come? And I'm all like, yeah, I just want to punch the shit out of somebody. I'm pissed. I'm angry. And this is a bad personality flaw, but I do it all the time. I'm like, I just want to fucking hurt somebody.
Okay.
So I show up. The office is packed, and there's this one woman sitting, like, and I had to go sit by her. She was pissed the fuck off. Uh-huh. I'm like, does this bitch got a gun? Because she was pissed. Yeah. And so the first person I met in your office was Brooke. And she came out, and she says, fucking wonderful. And she's like, he's stuck in surgery. You know, you want to wait? What do you want to do? And I was just like, she's good. Like, she's really nice.
Oh, my staff are phenomenal.
Yeah. Oh, and I was thinking,
nobody would operate with me if it wasn't for my staff.
Oh yeah, 100%. Because you totally, hang on, your score versus their score was fucked up from the get-go. So anyway, I
know this very well.
Oh yeah. So I was like, oh, she's wonderful. So then she came over to me and I'm like, oh my God, it's the same doctor. Oh, this is gonna be fucking good. Because this bitch was pissed. People, she was pissed. I'm like, she's gonna fuck us all up. Something was wrong with her. But let me tell you, this woman was beautiful. Uh-huh. And a little older, but I was just like, what the fuck are you in here for? Mm-hmm. You are gorgeous. And I remember thinking, like, again, just feeling much like, I know why I'm here, but you guys are all, like, why are you guys here? Because you look amazing, all of you. Anyway, so I was just like, so Brooke came over, she goes, oh, he's stuck in surgery. And for me, I'm all like, oh, I'm coming back because I got to know what happened to this bitch. And it could, everything in my ability not to leave her, goes, hi, I'm new here. What the fuck did he do? Like, I wanted so bad to know, what did he fuck up on? Come on, tell me the goods. I didn't. But deep inside, I'm all like, just lean over and introduce yourself and be like, what's wrong with you? And why does he suck? I didn't. So then I told Brooke, I'm like, I'll just come back. I was hungry. So I ran and got a sandwich. Well, when I got back, it was empty. It was just me. I'm like, fuck, I missed her.
Missed your chance.
Oh, damn it. Oh, no, I didn't.
Okay.
Because the door opened and she came out. Oh, this human being was a different woman. Oh, I was just being silly. I just need to talk to somebody. I'm all like, what the fuck did he do back there? You were going to kill everybody in the waiting room 40 minutes ago. And she was just like, and they're like, did he help you? And and I'm all like, what the fuck? So then I was intrigued. I'm all like, what did he like? What happened? Like, how did you smooth that pissed off you? I'm like, this might be the dude. Like, if he can handle that shit, he might be able to handle me. So we go back. It was Chantel, right? I always say Chantel. And this is the best part she did. And I remember thinking, they're good. They're fucking good. She put out 2 robes. Uh-huh. She goes, I don't know what size you are. Here's the 2 sizes. I'm all like, oh, bitch, you're good. You're good not to put a small robe out because you do not know what size I am. I'm all like, oh, nurses A+. Yeah. I had to wait still because whatever the fuck was going on in the office.
Good job, Chandel. Rest of you better freaking learn.
Oh, no. You all will get call outs of how fabulous you all are through this, Not him. But anyway, you like opened the door. You were on your fucking phone. That's what I...
No.
And you were texting. And I was like...
I don't do that.
Oh, dude. Like, I remember looking at him like, motherfucker. Double demerit.
Yeah.
I was pissed.
Angry with myself, okay?
But you were just like, whatever. I was pissed. I was all like, suck. He sucks. So then you hopped on like the stool, like a skateboard. Like, you're like, hi. And I'm all like, oh my God, he's a fucking idiot. Like, Jesus Christ, what is wrong with him? And you were just like, how you doing? Like, and I'm all like, what is this, a fucking bar?
Yeah, I'm a happy guy.
Oh, it pissed me. I was like, I waited for you. You're on your goddamn phone. And now you're acting like you're 5. Like, hello, Mr. Professional, please. And you rolled over and I was pissed. And you're all like, what can I help you? Like, what do you want? Was kind of the wording. I'm all like, well, I don't want to be in Playboy. And you looked at me and like, there's just a little smile and you go, I don't do that here. And I remember like, oh, fuck, he just lost a demerit point and gained a point. Like, and just the conversation in general, like, I just remember you being very different from everybody else because you were like, tell me about yourself. And I'm all like, why do you fucking care? Like, I just remember being very much like, this is weird.
Yeah.
Because you actually took interest.
Yeah.
In me in general. I'm all like, dude, I haven't even like signed your, I'm not even in the like page yet. Like, why are you being overly like, not car salesman, but it was just, and I remember like being like, oh shit, I think this might work. So we went through the whole thing. And what I remember is you never said the entire time, this is what you need done. versus the others that were like basically chalking me up.
Yeah.
Like saying, this is what you need, this is what you need done. And I remember thinking, this is weird. And you pulled out a piece of paper because I didn't know what a fleur-de-lis surgery was. And I'm like, I don't understand why I need this or that. And instead of, you're like, I'm just going to tell you the order that you should do it in with what I wanted done. But some of it, I had still not even decided I wanted done. I really came to do my legs. That was the number one thing. I wanted my legs done. But then you're all like, but you don't want this? Or you're like, I'm just going to tell you like the order to do it in if this is what you want. Mm-hmm. And you drew me like pictures. Like I still have it where you're like, this is what it will be. And you like totally explain it. I'm all like, ah, shit. And then I was like, please I was just mad. I was like, please don't be right. So then you're like, any other questions? But it was like, I'm like, he totally took the time to explain much more than anybody else explained to me at the time. I was like, holy shit. And then like they did the pricing and I loved when they came in, they're all like, this is what it is. Mm-hmm. And the only thing I remember you being like very firm on was the wound pumps. And you like said, I will not do that.
No.
You have to have it. I'm like, well, why do I have to have it? And you like totally went into like how gastric people don't heal as well and all of that. And I was just like, he's good. Fuck.
Here, sweetheart.
Oh, well, I was pissed. Like skateboard boy came flying in and I'm like, son of a bitch. I knew why the bitch walked out. I was just so silly.
Listen, we're coming back for part 2.
Okay.
As a wrap up, since we're ending on a good note for Dr. Howland.
No, for your staff, and you just managed to bring it home. You almost lost the team the points.
For the staff. As we wrap it up, I'm just going to say it because we haven't gotten to that point yet, but you were the inspiration for the podcast. And that's what we're going to dig into.
You're going to have to cut that.
I know. Okay. That's just a teaser. We're going to dig into that the next episode, but you were the inspiration for this podcast. And so anybody who's listened to part 1 here, stay tuned because Cori's story just gets phenomenal. Even more so. Thanks for coming.
Thanks.
Thank you so much for listening to The Naked Patient Beyond the Operating Room. I'm Dr. Nicholas Howland. Please remember that every patient who appears on this podcast has consented to discuss their story and their surgery on the podcast. That way we remain HIPAA compliant. This is a free podcast. The best thing that you can do for us is to leave us a review online. Let us know what you liked. Let us know what you'd like to hear. Let us know how we can improve. If you are curious about anything related to plastic surgery, you can reach out to me on Instagram at Dr. Nicholas Howland, and I typically respond there, or you can reach us at the office at 801-571-2020, or we have an online form you can fill out at the website, www.howlandplasticsurgery.com. Any of our coordinators would be happy to help you. Thanks again for listening.
Thanks for listening to the Naked Patient Podcast. Stay tuned for the next episode. Till next time.